Hi everyone, Michelle Wennis here with Green Women and Your Childbirth, and it's just a little over 2 weeks since my double or bilateral mastectomy and deep flap reconstructive surgery. And I am wanting to share just, what kinds of things to expect, and so you might have an idea of friends or family or even yourself, what things look like after surgery. So one of my concerns was, oh my gosh, am I going to wake up? And what does 10 to 12 hours of surgery really look like? So lucky for me, I went in, closed my eyes. I don't even remember being wheeled into the operating room, opened my eyes, and it was over. And I said that was what was going to happen, and it was. So my greatest concern was really for my husband, who did not want to leave, wanted to stay there. I just can't imagine what was going through his head or his mind, and he's not going to share with me. But I would think that that's something you guys would want to be ready for, does your person who's going to be there for you need some company or want to just be left alone? And if there's anywhere for that person to go grab something, if that person needs to step out for a little bit, is the hospital going to be able to get a hold of that person by cell phone, or sometimes they have a beeper. So, those are the kinds of things that you're going to want to think about. Let's see. So after the surgery, there are a lot of drugs, and I'm a pretty, holistic, stay away from unnecessary drugs as much as possible, unless absolutely needed. But you need to really trust the surgeons and the hospital that you're going to be at. I was at St. Mary's in Waterbury, and they were excellent. I was with Dr. Sealing as my breast surgeon in Southbury, and she's phenomenal. And I can say the same for Dr. Jandali in Trumbull. He's our plastic surgeon or reconstructive surgery surgeon, and he was there with Dr. Agaj as well. So for the surgery, it's only about 2 hours that they're doing the mastectomy. And at the same time, with the deep flap, you've got the 2 reconstructive surgeons already starting to work down there underneath. And then once the breast material has been removed, then they biopsy that. And then the reconstruction process, basically they take the fat and then they move it up here, make sure the vessels all align, do their thing, and so that can take anywhere from 10 to 12 hours. So you have to think about whether or not you want to do reconstructive surgery at the same time, or if you want to go back and do that later. You also want to think about, do I want implants, or do I want to try using my own stuff? There are a couple of different options. There are pluses and minuses to anything and everything that you choose to do, and you've just got to go with what's most comfortable. So as far as the drugs, typically there's an antibiotic, different kinds of pain meds. If you have allergies, they'll obviously take that into consideration. Some of those medicines are going to make you nauseous, so there might be some anti-nausea medicine. Blood thinner is important because they want to make sure, especially in the beginning, that you don't get clots. So as soon as you're able, they will encourage you to walk. They will have you use this machine, a little spiro thing. You breathe in and out, and there's like a gauge, and you try to do that 10 times at least within an hour, and that opens up the lungs. So when you're under surgery for a long period, especially, the lungs will protect themselves, and in a very non-scientific way, I will explain to you that part of them will close because there's no benefit for all the lung to have its whole capacity. So in any case, so that helps to open the lungs up. You'll be constantly checked for your vitals. If it's a teaching hospital, obviously people will come in and ask lots of different questions. I'm sure you can talk to your doctor and say, please minimize visits from students or what have you. In my case, I really didn't care. Let's see. There are drains that need to be checked, and I have cleaned them already for you. You have to learn how to do this. At the hospital, they do it for you. With the surgery that I had, there are 4 of these. 2 that come out at the top, so 1 from each breast, and then 2 at the bottom, just in your pelvic region. I'm down to 3 now. And those collect liquids that your body will release. And they don't want that to kind of bloat you up. So that has to be collected and monitored. When you're at the hospital, they monitor just what time they drain them, drains 1, 2, and 3, how much output there is in terms of milliliters. And then you go home and you do the same thing. So I had my hubby help me with that, and my mom as well. And when you're well and able, you can do it yourself. So they want to see less and less. And depending on the surgeon, the reconstructive surgeon, they have a comfort level as to how many milliliters each of those drains outputs before they can pull them out. And then at that point, there might still be, let's say, so they pulled it out of this breast first, and there might still be some draining that is happening, but not enough to worry about. It would be reabsorbed by the body. So those are the drains. Trick for the drains is if you're trying to do this, you have to milk them. And milking them means away from the body, you're going to take this section and you're going to pull, right? Now that hurts. There's friction involved. So what the nurses do is they have their gloves, but at home a nice trick is if you have alcohol wipes, and then those kind of make it a little bit easier. Use the wipes, your hands don't stick, and then you're able to milk the drain. So again, milking is like kind of taking the liquid away from the body and into the drain. So the first time you do it, you'll see new liquid will come in, and so you do it a second time. That's how I was taught. Let's see. When you are ready to go home, they will send you home, and understand that you are not going to be the same person in terms of your vitality, energy, and it's almost as if, so you've had a double mastectomy or a mastectomy, so that's one major surgery. The DIEP flap surgery is like a tummy tuck, and then the moving it up here, so it's almost like 3 surgeries at once. So you're exhausted. You're a human being, right? So understand that as much as you're going to need to walk, and they're going to need you to keep using this machine as much as possible to open those lungs. Your torso is a lot shorter because they've removed this flesh, so you will be hunched over. It's really, really weird on the muscles because you're now leaning into different muscles as you walk. You will be walking very slowly, and then over time you will start to stand up a little more erectly, and then also more quickly. It's not a race, okay? It's exhausting. The fatigue is unbelievable. So just expect that, and don't expect more from yourself than what you can do. Don't push to the point of hurting yourself. Definitely push just for strengthening. Your doctor or the hospital might give you something like this. This is a pretty little pillow. I had a little stuffed monkey I brought with me. It's good to have at the hospital. You cover your belly with it because you're going to have this incision. If you use my procedure, you have an incision hip to hip, a little bit beyond actually. And so when you're coughing or you're laughing, it just really, really hurts. You've got this pressure that's pushing on the abdominal wall, and they put a lot of stitches in there. You don't have to really worry about it rupturing. And my plastic surgeon actually does the stitches underneath in the skin, so you don't even see this giant line at the beginning, and it'll probably get less and less over time, but it's very sensitive. It feels like being stabbed, even with medicine, so if you're coughing. And so you press against this, against your incisions on the bottom. The top here you leave alone. You don't sleep on them. You don't sleep on your side. In fact, you have to sleep on your back. Understand too that you can't be fully extended. You have to be partially reclined. So that being said, what kind of things to have at home? You're going to want to have, if possible, a recliner. My insurance company allows you to, if the surgeon prescribes a hospital bed, then they let you have that. I didn't want to feel sick and dying in my own home, so I opted not to do that. And a very, very good friend of mine was able to find me a recliner. Automatic is better, so that when it requires little effort to open it up. I did need help closing it, but that's okay, because as long as you are not alone and you have family and and someone to help you close it, that's good. You're not going anywhere very often anyway. And to get up from it, even without closing it, it's helpful to just kind of sit and catch your breath and then get up again. So the recliner is very helpful. A notebook so you can track your medicines the way that I did. This is from that same friend, group of them actually. You're going to want to maybe write down the different medicines. This is an antibiotic Bactrim that I was supposed to take, but then I had a cough, unfortunately, that I had caught going in, so they had to change the medication a little bit. I listed every different medication in different sections, and then you just make sure so you don't forget. You just check off, how often and what time. It helps to keep track of things. It helps if there's someone there who's able to help you track it, and then eventually you can do it yourself. So you want a notebook. Those same friends as well made sure I had lots of books. Understand that the anesthesia and medication can make your eyes really blurry at the beginning. So as much as I would want to read some of those books in the beginning, and they did say this, it was more for when I got home that I would be able to read. Your eyes can be a little bit blurry. So DVD's lip balm was incredibly helpful. You don't even think about how dry your lips can get. And so they had face wipes for me because, you can't like doll yourself up every day. They even had dry shampoo. Depending on your reconstructive surgeon, you may or may not shower until these drains that they put in your body are removed. So mine allowed me to, as long as I was showering from the back. And so my husband would wash my hair and get my back and everything, but some people might just not be allowed to do that. So the dry shampoo is helpful. Not every doctor asks for this, but depending on how awesome of a doctor you have, a surgeon, they might order a visiting nurse to come and help you. And that has been wonderful. So as long as the drains are in, a visiting nurse comes in every day to help. In fact, I think she's pulling up now. And that's perfect timing because that's all I really wanted to talk about. So I guess I'll talk a little bit more about that. Any additional stuff I'll list later. Tram, come here. It's okay. It's okay, buddy. Tram. Speaking of which, Tram, come here. No, it's okay. So speaking of which, there are different things that you'll want to do to prepare before the surgery, especially if you have pets who are this loving. He loves me so much. So we'll talk about that next time. What can you do to prepare your pets, your family, and your friends? I just love this dog. Anyway, it's Michelle Wennis with Green Women and Your Childbirth. I am hoping that this was very helpful and not too scary. By the way, this is where you collect the this is where you collect the drainage they give us to at the hospital. Okay, thanks so much. Tram says bye, and mommy is okay. Mommy's okay. Well, anyway, thank you, and thanks for letting me do this tribute to Hugh Hefner. Very, very comfortable to wear like a robe or a button-down shirt or a zip-up when you go to I think you heard all that. All right, bye, guys. Tram's not going to stop, so have a good day. Bye-bye, Michelle.